The two most common lifts used to move patients in hospital and home care settings are overhead lifts and floor lifts. Floor lifts are much harder to use than overhead lifts because 1. They require more effort to move, 2. The pulling of the lift, usually in a confined space, requires a lot of twisting, straining, and pulling. 3. Using only the handles places the caregiver far away from the center of rotation of the device. 4. In the home environment, floor lifts are particularly dangerous as they often are pushed over carpets, thresholds, and through doorways. If a healthcare worker needs to use a floor lift, here are some simple tips that can help prevent back injuries. 1. When turning the lift, push or pull the boom from the top. This gives the operator more leverage, making it easier to move. 2. Push the base or forks of the lift with a foot to get the device moving, or to get more leverage when turning. A better alternative to floor lifts are overhead lifts, which run on a system of tracks above the patient's bed. These lifts are safe and easy to use, greatly reducing the risk of injury for healthcare workers. While an overhead lift is preferable to a floor lift, both lifts still present risks when placing a sling under the patient to prepare for transfer. Most healthcare workers use the log roll method, but this action requires the caregiver to maintain a bent posture for a prolonged time, increasing the risk of back injury, particularly with a bariatric patient. To solve the log roll problem, researchers at Toronto Rehab have developed SlingSerter. It's an easy-to-use tool that effortlessly inflates a series of lifting straps under the patient, greatly reducing the risk for injury. Once the straps are placed under the patient, they can be attached to an overhead lift, which gently raises the patient up a few inches, making it easy to insert the sling. Having the patient elevated a few inches also gives healthcare workers the opportunity to insert a bedpan, change sheets, or reposition the patient as needed. SlingSerter is just as easy to remove. Just pull the exposed end out. It's also designed with the patient in mind. As you pull, SlingSerter turns inside out so there isn't any friction or discomfort from the straps for the patient. Using the right tools can make lifting and transferring patients easier and safer, reducing the risk of injury to caregivers. For more information, visit preventbackinjury.org.